Understanding the physical and mental health changes that our aging parents may go through is critical to ensuring their well-being. Monitoring any changes in their physical condition can assist us in identifying potential medical needs. Difficulties with daily activities, memory problems, poor balance or mobility, and the presence of chronic health conditions are all warning signs that our elderly parents should seek medical attention. Similarly, being aware of warning signs of memory loss, cognitive decline, emotional and behavioral changes, and difficulties with daily activities can assist us in taking preventative measures and ensuring they receive the care they require. Identifying signs of social isolation and loneliness, as well as communication difficulties, can also help us provide appropriate support and assistance to our elderly parents. We can prioritize their health and well-being in their later years by remaining vigilant and responsive to these changes. It's vital that we monitor any changes in our aging parents' physical condition. These alterations may indicate the need for medical attention. Some warning signs include difficulty with everyday activities. Difficulty with routine activities like getting dressed or bathing may indicate that your parent needs assistance. Memory problems. Problems remembering things like medications or bills should prompt a visit to a doctor, but memory loss is a normal part of aging. Poor balance or mobility. Due to difficulties with either mobility or balance, older people frequently hurt themselves in falls. It's important to address your elderly parents' balance and mobility issues to keep them from falling. Chronic health conditions. Conditions that worsen over time are called chronic health conditions, and they are more common as people get older. Your elderly parent may require medical assistance if they have a persistent health problem. The health of our parents, especially their minds, should be a top priority as they get older. Memory loss and cognitive decline are common as we age, but they may also indicate the need for medical intervention. By keeping an eye out for these shifts, we can take preventative measures to guarantee that our aging parents get the care they require. Forgetfulness. Increased forgetfulness is one of the earliest indicators of memory loss and cognitive decline. It may be a sign of something more serious if your elderly parent frequently forgets things like appointments, conversations, or recent events. Difficulty with daily tasks. Challenges in completing daily activities are another potential red flag. Your parent may be experiencing cognitive decline if they are having trouble with everyday tasks like cooking, cleaning, and managing money. Confusion and disorientation. There are many different manifestations of confusion and disorientation. Your parent may become disoriented in time and place, have trouble recognizing familiar faces, and become disoriented in their surroundings. These signs and symptoms should not be ignored and could benefit from a medical evaluation. It's crucial to monitor the mental and behavioral health of our aging parents. In order to ensure their health and safety, they may need to see a doctor occasionally. Here are some warning signs that your elderly parents may require medical attention. Frequent mood swings. Observe if your parents' moods swing more frequently and dramatically than they used to. Without warning, they may become more irritable, depressed, or anxious. Social withdrawal. If your parent begins to withdraw from social activities they once enjoyed, this may be an indicator that they are experiencing emotional distress. They may withdraw from their usual social circles, avoiding contact with loved ones and neighbors. Neglecting personal hygiene, such as not showering regularly, wearing dirty clothes, or not caring for one's grooming, can be a sign that your elderly parents are having difficulty performing these tasks on their own and may benefit from some assistance. Watch out for drastic shifts in their eating habits, which could indicate poor nutrition and a loss of weight. They may be having trouble preparing meals or have lost interest in eating if they are shedding pounds for no apparent reason. Not getting enough to eat can have negative effects on your health. Memory loss and muddled thinking are symptoms of cognitive decline. You should consider getting help if your parents have trouble keeping appointments, forgetting names or places, or getting lost in familiar places. Concerns about isolation and loneliness in the elderly are real. Your parents may be experiencing feelings of loneliness or isolation if you've noticed them withdrawing and spending more time alone. Lack of interest in social activities, decreased communication with friends and family, and an overarching sense of sadness or depression are common indicators of social isolation and loneliness in elderly parents. They may also seem to have trouble sleeping or have lost their appetite. Taking action may be necessary if you observe any of these symptoms. Consider enrolling them in a senior center or community program, or hiring a carer on your own.